So, posture and low back pain. Now, there's two very simple ways of understanding posture and low back pain, and that correct posture reduces pressure and incorrect posture increases pressure. Now, with regards to pressure, we're going to talk about that in a couple of slides' time. So, the main thing we have to understand, if I can just bring you to the little diagram on the right-hand side of the slide there, is you've got two pictures, obviously the front or the back of a person, and you can see on the picture on the right hand side all the lines or all the joints, they're nicely aligned. So if you look at both sides of the body, you can see that they're symmetrical with each other. Now when our body is in that symmetrical state, it reduces the amount of pressure on the joints. As we then move on to the picture on the left hand side, you can see all the different lines or the joints are sort of asymmetrical. So if you look at either side of the body, it's asymmetrical. We've got one side higher than the other, we've got another side lower than the other, and so on and so forth. If you look at the foot, you can see it's collapsing inwards, so that's creating pressure. So what we have to be able to do is, with our posture, we have to be able to create symmetry, because it's that symmetry that's going to help us reduce pressure. Now, with regards to creating symmetry, it's not just a sort of joint alignment. We can also have sort of muscular imbalances. So we can have muscles on the left side bigger or stronger than muscles on the right side. Now, obviously, this can be a little bit more challenging with regards to sort of managing our low back pain. But if we can first of all have the understanding of it, we can then start to identify places in our body that can be contributing towards our low back pain. So sort of principle number one with regards to low back pain is about creating symmetry. So we want to be able to look at our body and see, are our shoulders in line, are our hips in line, are our knees in line, are our feet sort of in line, do our feet collapse in, so on and so forth. So sort of point number one is we need to be able to create symmetry to reduce the pressure on the joints of the body, so then obviously that's going to minimize our risk of injury to those joints. If we bring them out of symmetry, we create an excessive pressure on one side or both sides, and then we'll create a compensation, and then eventually that will create a pain, and obviously the pain is an injury, or covering up an injury, or letting us know an injury is there. So the incorrect posture can start from, well, it can start really from anywhere: the feet, the knees, the hips, the shoulders, the neck. So as you can see in that picture, that's exactly what's happening. So when it comes to low back pain, when we're identifying low back pain, sort of principle number two is, don't just focus on the lower back. That's where the symptom is expressing itself. That's where it's coming out of. What we have to do is we have to then look at our body holistically and look for these asymmetrical postures or asymmetrical joint alignments, whatever you want to call it, and start correcting those. Because as we start correcting those, now not also joint alignment, but also muscular imbalances. So we may have sort of overactive and tight muscles on one side of the body. We may have underactive and slightly looser and longer muscles on another side of the body. So we have to start readdressing these balances. Now, again, that can stem from the feet, it can stem from the knees, the hips, the shoulders, and the neck. The reason it can stem from the feet is quite simple, in that if, for instance, as a child, you had lots of twisted ankles, obviously that's going to create muscular imbalances, which is then going to have a knock-on effect up into the knee, up into the hip, up into the lower back. If you have flat feet, if you look at the picture on the left hand side and you've got a circle around one of the feet, you should be able to see that that foot is slightly fallen in, so it has a collapsed arch. Now again, flat feet will create an asymmetry in the ankle, and then again that will translate itself up into the knee, up into the hip, and then up into the lower back. Obviously there'll be slightly more bits to it, and it can happen at different joints. I'm just focusing on the foot just to try and get the principle across. But what we need to be able to do is we need to be able to look at the body sort of holistically and try and find where these asymmetries are. If we can find out where the asymmetries are, we can then find out where the back pain is potentially manifesting itself. Now, at the moment, I've just been talking about a static posture. What we also have to do is we also have to look at dynamic postures. So when we're moving, so walking or bending down or picking things up or pushing things away from our body or pulling things towards our body, i.e. pushing and pulling a door open, walking upstairs. Because if we can see our body moving dynamically, we can then again see asymmetries. We may have a right side which is dominant over our left side or vice versa. Now that's going to create muscular imbalances. That could then create joint imbalances. That could then create pain in our lower back. So by looking at our static and our dynamic posture, we need to be able to find these asymmetries. Okay, what we're going to do on the next slide is we're going to look at, I've been looking at the moment from a sort of a side to side of the body. So we've been looking from the front or the back of the body, looking at either side of the body. In the next slide, we're going to look at looking from to the side of the body and what that's creating and how it's creating an asymmetry. So I'll click through and we'll crack on.